This video only covers selected highlights of the RemunityPRO pump user guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the RemunityPRO pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. In this video, we will review the steps required to change out a used cassette for a new one and restart delivery. A cassette change should be performed within the last 2 hours of therapy after receiving a cassette low alert. Before you begin, gather all of your supplies and make sure your work area is clean. For this video, you will need the RemunityPRO pump, a fully charged pump battery, the remote, a new cassette, new infusion set, alcohol wipe, Remodulin vial, 3 ml syringe and needle, and sharps container. To begin a cassette change, tap Main menu on the remote and select Change Cassette from the options. Tap the check mark to stop medication delivery. After stopping delivery, disconnect the infusion set tubing from the infusion site. Tap the check mark on the remote to continue. Do not remove the used cassette from the pump until after removing the infusion set from your body, to avoid unintended delivery. To remove the used cassette, hold the cassette still and rotate the pump counterclockwise until the ridges on the pump bump are aligned with the top of the cassette. The pump will play a one-tone beep. During a cassette change, avoid unnecessary contact with the inside of the pump and cassette, which are exposed. Additionally, keep dirt, lubricants, and liquids away from the inside of the pump and cassette. Dispose of the used cassette and infusion set. Before attaching a new cassette to the pump, replace the pump battery with one that's been fully charged. Remove the depleted battery from the pump and insert it into the battery charger. Retrieve a fully charged battery, indicated by a green status light on the battery charger, and insert it into the pump. When the battery is inserted successfully, the pump will play a quick beep, followed by a ready beep, and the remote will advance automatically when it is ready. Do not press any buttons until the second beep is heard. Next, prepare the new infusion set tubing and cassette. Wash your hands with soap and water and make sure your work area is clean. Open and remove the new cassette and infusion set from their packaging, then attach the infusion set tubing to the cassette by twisting the lure connectors together. Make sure the surfaces of the cassette and pump are clean and dry. Attach the new cassette to the pump by aligning the ridges on the pump bump to the top of the cassette. Push down and rotate the pump clockwise until the pump bump is aligned with the infusion set tubing. The pump will play a series of beeps while it conducts a self-test, which is displayed on the remote. Wait for the self-test to complete before continuing. Now fill and prime the new cassette. Only fill cassettes at the time you plan to use them. Start by confirming that the delivery rate displayed on the remote matches your prescribed rate. The programmed delivery rate determines the amount of medication to fill the cassette and the hourly medication rate. If the delivery rate displayed is correct, tap the check mark to continue. To edit the delivery rate, tap the pencil icon and enter your 6-digit passcode. Swipe up or down on the remote to adjust the delivery rate and tap the check mark to confirm. The remote displays the amount of medication required to fill the cassette. Remain on this screen until after filling the cassette. To fill the cassette, start by cleaning the top of the Remodulin vial with an alcohol wipe. Open a new syringe and needle and attach the needle to the syringe by twisting until finger tight. Carefully remove the cap from the needle and pull the syringe plunger out to the volume displayed on the remote. Insert the needle into the vial and press down on the syringe plunger to add air to the vial. Then, flip the vial so it is above the syringe. Slowly pull down on the plunger to fill the syringe with the amount of medication displayed on the remote. Tap on the syringe to remove any air bubbles, then remove the syringe from the vial. Now, fill the cassette with medication. Hold the syringe like a dart for proper insertion. Insert the needle straight into the filling port until you feel resistance. Press on the syringe plunger slowly to inject the medication. If the medication is difficult to inject, withdraw the needle and try again. Continue to hold the syringe plunger down with your thumb while removing the syringe. Dispose of the used syringe and needle in a sharps container. Tap the check mark on the remote to confirm the new cassette was filled with the amount of medication shown on the remote. Once the cassette has been filled, prime the infusion set tubing. Tap the check mark on the remote to begin. The pump will play a series of beeps to indicate priming has begun. Watch for drops to appear at the end of the infusion set tubing, which indicates the cassette is primed. Once drops are visible, tap the check mark on the remote to stop priming. tap Yes to confirm priming is complete. Inspect the luer lock connection and infusion set tubing for leaks. If any leaks are visible, replace the cassette and infusion set tubing. Now connect the primed infusion set tubing to the infusion site. Tap the check mark on the remote to start delivery. The pump will sound and the remote status bar will change from blue to green to indicate delivery is in progress. Verify the delivery rate displayed on the home screen matches your prescribed delivery rate. Wipe up any medication residue with an absorbent towel or cloth and clean any areas that came into contact with the medication. RemunityPRO pump for Remodulin treprostinil injection. Indication: the RemunityPRO pump for Remodulin treprostinil injection is intended for continuous subcutaneous delivery of Remodulin treprostinil injection for use in patients ages 17 and older. Important safety information for RemunityPRO. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only RemunityPRO cassettes may be used with the RemunityPRO pump. RemunityPRO pump is for use only with FDA-cleared infusion sets. Medtronic Quickset Infusion Set, MMT-392, MMT-393, Naria Guard, 704060-5229, 704060-5226, Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7230-24, 21-7220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. If the pump or remote fail to work as detailed in the user guide, stop using the pump and remote and switch to the alternate pump and remote included with your system. Only use the supplied cables with your RemunityPRO system, as other cables could interfere with pump function. Disconnect the infusion set tubing from your infusion site before removing the cassette from the pump. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Keep the pump, remote, and battery charger at least 12 inches, 30 centimeters, away from electrical, medical, and wireless devices. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire, burns, and property damage. This system supports flow rates between 8 microliters per hour and 225 microliters per hour. If the required flow rate is outside this range, discuss with your specialty pharmacy or healthcare provider. Prescription information. Caution. Federal law USA restricts this device to sale by or on the order of a licensed healthcare provider. Use of this device without the training and supervision of a healthcare provider may lead to errors that result in harm. See the RemunityPRO pump for Remodulin treprostinil injection user guide for further detailed important safety information, including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corp. at 1-844-864-8437. The RemunityPRO pump for Remodulin treprostinil injection is manufactured for United Therapeutics Corporation. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin treprostinil injection. What is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver problems. Your Remodulin dose may need to be adjusted if you have liver problems, have low blood pressure or bleeding problems, are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure, symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-844-UNITHER, 1-844-864-8437.